Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal. Every week, myself and my co-host, Dr. Mike, bring you the information that doctors talk about in doctors' lounges all over the country. We try to give you the information that you require so that you can be prepared to advocate for yourself and for your family and arm yourself with the information necessary to fight for your healthcare freedom. The Docs for Patient Care Foundation supports this radio show, and we are the only physician-led healthcare think tank in the country. Our efforts require your help, and that is important so that we can go to Washington and do the work that we've been doing, and there's a lot to discuss regarding that, to put this show on, to put on our conference on direct primary care. So please go to our website, www.d4pcf.org. That's D, the number 4, pcfoundation.org. Contribute as much as you possibly can. Our efforts are so incredibly important, and your help is so valuable, so necessary, so that we can do what we have been doing and continue to do it and fight for the doctor-patient relationship and healthcare freedom for every American. It seems like every day there's a new issue in the news cycle. Every week there's much more going on that requires comment, and the only thing that we can be sure of is that with every day there's going to be some new challenge and something to push back against. And I think that today I would like to try to develop some clarity and continuity and put together certain things that are converging in healthcare. And so the thoughts that I had to try to put healthcare issues in a neat little package really boil down to 3 general topics. It's Donald Trump on healthcare. It's healthcare transparency and pricing and mostly giving consumers what they require in order to be able to become good consumers and shop for health care. And surprise medical billing, which is one of those topics that have come up recently. It's a talking point that has bipartisan support and that everybody seems to be behind, and yet the devil is always in the details trying to sort this kind of problem out. And all 3 of these issues pretty much converge and come together. And so that's really what I'm going to try to spend this show putting together. It's been a real whirlwind a couple of months for those of us in Docs for Patient Care who have been fighting the battles in Washington and in the healthcare policy arena. Dr. Lee Gross, Dr. Mike, myself, we've been going to Washington. We had the privilege of being in the White House for the executive order signing on healthcare transparency, which was monumental. It was a huge kind of honor to be there, and it was the culmination of a decade's worth of work trying to advocate for health care for patients other than through the traditional insurance-based third-party payer model. And Donald Trump has been a real advocate for this and a real friend for medicine. But I have had also the opportunity to engage with thought leaders in the conservative movement and be able to present to them healthcare issues, and I think that there's an appetite to really fix healthcare. Nobody really was listening before the Trump administration, and now I believe with all my being that there are people who truly want to fix this problem, and they are receptive to those who have the experience, who have the knowledge. And we at Docs for Patient Care have had the privilege and the honor to be able to engage and to be involved in these conversations. And we are not we're as the people who have been involved in this up until we came on the scenes have been pretty much mostly policy people who really had no idea about what it was like on a day-to-day basis to take care of a patient, to deliver health care, to write a prescription for somebody, to make a life and death decision. And with Docs for Patient Care involved, people who are actively practicing doctors who know what those issues are, we come to those who are interested in fixing health care with not just knowledge about what the policies are, but practical experience in how to take care of patients and what the nuances are, what the problems are. And so I think that credibility that we bring really has been recognized, and now people are truly listening, and I think that there really is an opportunity to turn things around. I wanted to point out really where we are right now, because we are beginning that every 4-year tradition of picking a new president, and healthcare, as it has been for the past decade or more, has in every election every 2 years has again remained at the top or near the top, the number one or number two issue on people's minds, and that's because it affects every single individual. And you can't get into any kind of conversation about taxation, about finance, about business, about anything without healthcare popping up. And the decision about who should lead our country really should include what their vision for healthcare is. And there is a binary choice about healthcare at this point in time. You've got people who are on the left who want to see the government take over healthcare, a single-payer system, socialized healthcare. And we've spent many shows discussing this, and we will talk about this more in future shows. But the Democrats have been hijacked by the left. There is no more liberalism. It's a far extreme left attitude, and they are committed to a single-payer socialized healthcare system, which the rest of the Western world is trying to disengage from in some fashion. And so the left is trying to drag us in that direction, despite its failures, despite the fact that other governments recognize that it doesn't work. The other thing that the left wants to do is they want to, at the same time they want the government to provide health care for everybody, they want to open up the borders to immigrants, illegal immigrants, and pay for all of their health care. They want to give free health care to everybody. So this becomes a magnet for the world to just come through, pouring through our borders, And our healthcare system is not designed to be the provider of healthcare for the world, and it's certainly not every taxpayer's responsibility to pay for healthcare for anybody who decides that they wish to come in here and participate in the American dream. There's a process for that, and we've basically thrown that away, and that's the position that the left has taken. So Donald Trump is the opposite. He is the antithesis of that position. And so there really is a binary choice about who should lead us from a healthcare standpoint. Should we have the left come in and destroy our healthcare system, which they did a good job of really undermining under Obama, and they want to go even further? Or do we want to bolster it? Do we want to fix the problems that exist and try to preserve what is unquestionably the best healthcare system in the world? You have people coming here who want to train. You have people coming here who want to get treatment. They're not going to Cuba. They're not going to Finland. They're not going to any of these countries on that make-believe WHO list of great healthcare systems. They're coming here. And so, yes, our system has warts. Yes, there are problems that need to be fixed. Yes, healthcare is too expensive. But we have a president now who recognizes that our system is flawed, that much of the problems stem from overregulation, from a system that has gone off the rails, and he has the foresight, he has the good judgment to bring in people who know what the problems are and can give sensible ideas about how to fix them. I think that Donald Trump has been the best healthcare president in the last 60 years, and I'm going to try to explain to you why I say that. What he has done in 2.5 years to promote healthcare has really been quite remarkable. I'm going to go through a list of some of the things that he has done that supports this claim, and why we're actually moving in the right direction regarding health care. So there's a list that I've compiled, and it's quite extensive. So stay with us and listen on our Facebook page on America's Web Radio, and you can actually see our podcast and you can participate. So stay with us.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hello, I'm Dr. Mike Karuchak. Have you ever wondered what doctors talk about amongst themselves? If you do, join us on the Doctor's Lounge and hear the doctors' conversations amongst themselves. Join me and my co-host, Dr. Hal Schertz, every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. We're talking about health care, what else, and how Donald Trump has been the best friend for health care in the last 60 years. I want to remind everyone to go to the Docs for Patient Care website and look at our upcoming direct primary care meeting in Orlando this November. It is the best direct primary care meeting in the country, hands down. Everybody who's a who's who in direct primary care participates. We're working on some very exciting keynote speakers that I'm not at liberty to share with you just yet, but I promise these are very, very high-profile, important people who are now recognizing the importance of the direct primary care movement and want to participate and support what we're doing. There are still some tuition-free spots available for physicians who are thinking about doing direct primary care or who are in direct primary care and have never attended one of our meetings. These are provided thanks to the generosity of the Physicians Foundation, who has been sponsoring this meeting annually for the last 3, and this will be the 4th meeting. So please check out the direct primary care banner on our website. So why has Donald Trump been the best friend for medicine? Let's start out by what he has done. First of all, he allowed more healthcare choice and competition across the U.S. by signing his very first healthcare executive order. Well, second. The first was to get rid of all of the penalties in Obamacare regarding the individual mandate. So he made it so that people were not compelled to get plans, healthcare insurance, as was the case under Obamacare. But his second executive order was to open up the insurance market. He made it possible for those, quote, junk insurance plans, which are not junk at all, and there have been a number of studies that have shown how important these policies, these catastrophic policies or these customizable healthcare insurance plans are to individuals who had absolutely no choice or who could not afford these big box insurance plans, one size fits all, where you pay for hair transplant and all kinds of ridiculous types of coverage, maternity coverage for postpartum women. For postmenopausal women, things that are just absolutely ridiculous. So now people can customize their health insurance and buy what they need. And these plans in under Obama were only available for 3 months. Now they're available for a year, and they can be renewed for up to 3 years. So that's number one. Number two, he has allowed groups that are origins or who have shared interests to band together and purchase group insurance as an association health plan. So, there are clearly associations that are recognized by the IRS, but then there are people who might be lawn care providers, lawn care specialists, or people who might be babysitters, or people who have a common shared professional interest where they're not really a true professional association. What he has allowed these people to do is band together and have their own association and purchase insurance together as a group. That was not possible before. And what he did initially was he allowed for a wider use of what's called health reimbursement arrangements, or HRAs, so that businesses could put aside money, earmark it for health care when they didn't have their own health savings account or their own insurance plan that they can enroll an employee in. He's also done things like signing an executive order to create a commission to combat drug addiction and the opioid crisis. Chris Christie is the head of this committee. He has signed a drug pricing transparency order, which has been struck down by the courts, who have been one of the biggest thorns in the Trump administration's side, activist judges, leftist judges, who are throwing up roadblocks for virtually every single executive order that the Trump administration signs. But that what he had done was his executive order called for drug companies to have to post the list price on TV ads for their drugs, so that they would then be compelled to compete on pricing. What they have also done is they have lowered the price for Part B Medicare, so that on the plans that are Medicare plans have to get favored nation status. They're trying to write a new Part D plan for the portion that's not physician-dispensed drugs. The physician-dispensed drugs are mostly the kinds of drugs that are given by oncologists, the expensive chemotherapy drugs, the expensive biologicals. Those drugs that Medicare covers were brought into compliance with what the drug pricing should be, so that they get favored nation status. The last executive order, the one that I was at, called for healthcare transparency. It mandated that hospitals needed to disclose what their prices are, so that patients can comparatively shop for health care. And I'm going to get into that a bit with this surprise medical billing again in a second, and the healthcare price transparency initiative. But what it also did was it called for, it allowed for patients who wish to get health care outside of the HSA insurance-tied plan. In other words, people who have health savings accounts are typically those who get them and they're tied to an insurance product, and your HSA benefit is really related to whether or not this is a covered service by your insurance company. So, for example, if somebody needed to go and get wanted to get a breast reduction, they had back pain. It's not an uncommon procedure these days. Women who have severe back problems because they have large breasts, many of those women decide that they want to get breast reduction surgery. And they've got to jump through a tremendous number of hoops in order for their insurance company to consider this a covered benefit. Most of them will go ahead and say that this is cosmetic surgery. Well, if you have a health savings account, you should be able to use that money that you put away so that you can pay for your breast reduction surgery. Well, because the insurance company with which that health savings account is tied says that this is cosmetic, then that's not an approved HSA expense, and you cannot use your health savings account to pay for it. Well, what Donald Trump just did was he uncoupled HSAs from insurance. And so if you want to use your HSA to pay for that, you could. If you want to use your HSA to pay for direct primary care, which you couldn't do before because of IRS regulations. Donald Trump has basically authorized the IRS to say, hey guys, this is okay. Figure out how to make this work, because people should be able to use their HSAs to pay for direct primary care. The same with HRAs, the health reimbursement arrangements. If I'm running a business and I've got employees and I have an insurance provision where I've managed to get insurance for my employees, but they can't afford it because it's too darn expensive. I can put away money for them into an account, an HRA, and if they want to go shopping for cheaper health care, for more expensive health care, like through direct primary care or through Hip Nation, they can do that, and they will be able to use the money in their HRA to do that. And as a business owner, I'm not penalized by giving them that money. I can put away that money for them as a tax-free event for me as a business and for them as a consumer. So everybody wins in this. And this is what Donald Trump has done. There's more that he wants to do. I just mentioned that he wants to do the Part D Medicare drug pricing, so that the Medicare is the Medicare will not pay more than other countries do for their drug pricing. And there's a lot of people who are pushing back against this. Surprise, surprise, the pharmaceutical industry saying, no, this is going to create a big mess if we try to do something like this. And not only does he want to do it for Medicare, but he's trying to extend it to TRICARE and to the VA and give them favored nation status. So I'm going to try to tell you what it's trying to do with surprise medical billing and what the problems with that in a minute are. So stay with us.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hi, I'm Dr. Mike Karuchak. Join me and my co-host, Dr. Hal Schertz, every Thursday morning at 8 a.m. and listen to the Doctor's Lounge, where you get a private insight into the conversations that doctors have amongst themselves. Join us Thursday, 8 a.m. every week.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docs4patientcarefoundation.org. That's www.docs4patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Okay, so healthcare and Donald Trump as the healthcare president, which I make the case that he is, way more so than anybody else in the last 6 decades. And he recognizes that there is a problem, and he has tackled these problems one by one, and people are coming to him with solutions, people like Docs for Patient Care. So one of the things on their list is this surprise medical billing, and we've talked about this a number of times, and I need to talk about it again because this is a very, very important issue. And this is a big to-do list on the Trump agenda. Now, this is an issue that has bipartisan support. And so you've got to ask yourself, okay, if it's got bipartisan support, why are both sides agreeing? Well, I think it has to do with the optics, because the optics are that patients with insurance are getting these bills in the mail after the fact when they've had treatment. Now, this is something that is really an important issue, and we're going to get into this if we have time, which is healthcare price transparency. And I'm going to have as my guest in the next few weeks someone who has dedicated their life right now to working on healthcare pricing transparency. Cynthia Fisher, who is a entrepreneur and now a self-proclaimed healthcare advocate for patients and also for businesses. So, but let's go back to surprise medical billing. Surprise medical billing, again, you go to the emergency room, you have insurance, you think that the hospital is a network hospital on your plan, you need an emergency operation, you think everything is covered, you know what your responsibility is going to be, and then boom, you're hit with an $8,000 bill from the anesthesiologist. Why? Because the anesthesiologist is out of network. Why is the anesthesiologist out of network? Well, there are two reasons why. Either because the insurance company could not come to an agreement with the anesthesiologist, and the anesthesiologist would not accept the rates that the insurance company wanted to pay them, or the insurance company simply was not interested in having them in the network. They wanted to narrow their network and get only those people in their network who were the cheapest alternative for them, and essentially limiting patient choice. So that's the problem, and nobody likes getting that bill, and politicians know that this is a real win for them. Every side can claim a scalp if they can get this problem fixed, including the president. Now, there's a bill that was originated in the House of Representatives. Actually, I'm not sure if it originated in the House, but there's a bill in the House, there's a bill in the Senate. Both of them have provisions in there to make this problem go away. And so they want to ban the practice of surprise medical billing. They want to prohibit balanced billing. Balanced billing means that if I'm a doctor and I have a patient that I take care of, they've got insurance, they get reimbursed a certain amount of money for their care. It doesn't cover my charges, I can balance bill them. That's the way it used to be pre-1964. It's not as common today because most doctors are on networks and they will accept assignment, but the out-of-network doctors can balance bill. This House bill will compel doctors who are not in network to accept the insurer's median network rate, which means that if I'm a doctor, I've given care, I'm out of network, and what this bill is saying is that the insurance companies will be compelled to pay for that patient's what service I provided to the patient, and pay me as the provider what the average rate in the community is for that procedure. Now, bear in mind that the average rate that insurer is paying has been created. It's been arrived at based on what the insurance companies are willing to pay. That binds doctors to the terms of contracts that they have never signed. They're being compelled, according to this plan, to take that money and be satisfied with it. They have no recourse. There's no arbitration. There's no room in this bill for any kind of dispute, and it tilts healthcare in favor of the insurers who have created this problem by compelling doctors to accept payment rates that insurers were unsuccessful in negotiating. And the government imposed price is going to be far lower than what the market price is. And it creates a powerful incentive for an insurer to reduce reimbursements for their in-network providers, to further narrow their networks, knowing that those who refuse to sign those contracts are still going to have to accept those lower prices. It's going to continually ratchet down what doctors get paid, and everybody who thinks that doctors are absolutely, just rolling in dough are wrong. Most doctors are running a practice at 50, 60, sometimes 70% overhead. Most doctors have not received a rate increase in years, and I mean many years. The insurance companies, on the other hand, are making record profits. Let me share with you some of the insurance company profits. These are a comparison of the first quarter only, just 1 quarter of the year. So you multiply this by 4 to get annual earnings or profits. So if you take the big gorilla in the room, which is United Healthcare, in 2014, in the first quarter, they reported profits of $1.1 billion. That went up in 2017 to $2.2 billion. And then for the first quarter of this year, their profits went up to $4.8 billion. That is unbelievable how much their profits are. And it's not quite as much for the other insurers, but it's quite high. Kaiser's profits from the first quarter of this year were $3.2 billion. Cigna, $1.4 billion. Blue Cross Blue Shield Anthem, $1.9 billion. So these insurance companies are raking in record profits, but that's not enough for them. They don't want to negotiate fair prices with doctors. They want to. It's incredible the amount of greed that is displayed on the part of the insurers, and they want to lower reimbursement to physicians even further and increase their record profits even more. And why is this bad for patients? Well, I'll tell you. When doctors make less and less and less, which is what this surprise medical billing initiative is geared towards, that means that doctors can't stay in private practice. They will have to sell their practices to hospitals. And hospitals, and I'll come with that data in the next show, but hospitals are making record profits. If you travel around the country and you go to any major city, what are the largest building projects that you see around the country? It's hospitals. They're putting up these enormous monuments to healthcare, and the healthcare interests, the hospital systems, are divvying up communities, jockeying for position, and fighting for market share. They're buying up physician practices. They want to buy physician practices. Why? Because a study came out that for every doctor that is hired by a hospital, the hospital makes $2.5 million of profit per doctor. So if a hospital is paying several $100,000 for a doctor, they are just absolutely reaping in the benefits. They are raking in the dough and making a tremendous amount of money. So the allure of hiring doctors, of getting doctors to get out of private practice and come and join the hospitals is a real threat. And so Obamacare made an attempt to end private practice of medicine. And if this surprise medical billing initiative gets through as proposed, the current Congress and the president, and I hate to lump the president in on this, will succeed in doing what Obama could not do. They will essentially end private practice healthcare in America. And so this has got to go away, this bill. Clearly, if they try to do this, litigation will follow because the federal government will be curbing the freedom to privately contract of doctors with insurers. And when you add on the fact that doctors are compelled to see patients who show up in hospitals, and then to force them to have to take a reimbursement that they have not had the opportunity to negotiate, this goes against every principle of American free enterprise and contract law and ethics. So this initiative is being cheered on by the insurers who are making the record profits, by hospitals, by employers, and by patients, because patients are getting the wrong message. And I'm telling you, I'm delivering to you what that actual message is, what it should be. The physician groups are saying that they want binding arbitration as part of it. And yes, I think that should at the minimum be what's part of this initiative. But the real solution is to get rid of the third-party payment system and to put the power back into the hands of patients, to get transparent pricing, and to have hospitals pick up the tab for the doctors that are not on their networks for elective surgery, or to get the insurers to pick up the tab for the out-of-network physicians for emergency surgery. Hospitals get tax breaks for writing off their bad debt. Doctors don't. If you want to compel doctors to have to take this bad deal, then you need to, I think, as a government, work in some kind of provision for the doctors to get the same kind of tax breaks as the hospitals. So that really takes us to this break and why this surprise medical billing initiative is a Trojan horse for single-payer health care and also for the end of private practice. So stay with us.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hi, I'm Dr. Mike Karuchak. Join me and my co-host, Dr. Hal Schertz, every Thursday morning at 8 a.m. and listen to the Doctor's Lounge, where you get a private insight into the conversations that doctors have amongst themselves. Join us Thursday, 8 a.m. every week.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
So I've spent the last 3 segments of the show trying to give people an understanding of why I consider Donald Trump to be the healthcare president, why the choice for the next term, the next president, is going to be a binary choice between somebody who supports healthcare and a party, regardless of who the candidate is, who wants more government and wants to take away healthcare from you. I've talked about why the optics of surprise medical billing looks good, but the devil's in the details, and why, as proposed right now at this time, the solutions are just one big giant wet kiss to the insurance companies who created the problem, and it's going to harm the people who are delivering the health care, to the extent that it will drive out the 1/3 of physicians who are still in private practice out of private practice and into hospital employment, because they can no longer afford to stay in private practice when the bottom drops out. And that's just the way it truly is. The issues that surround healthcare price transparency. This is a big problem, a big issue, and I'm gonna do something which I'm gonna take a little bit of license in this show and in my last segment, and I want to thank David Moxley, our producer, for being such an advocate for the things that he hears me and Dr. Mike talk about every week. He cross-pollinated the senior hour with the Doctor's Lounge, and introduced the ideas into that show that we talk about all the time, about choice, about lowering costs, about direct primary care, things that you hear us talk about all the time. So I thought that I would cross-pollinate that show, which he participates in, and share with you something that I just love, which is a real cool email that one of my friends sent to me that is meant for the senior hour. And I'm going to read it to you, and I think that if we have time, I'll let David chime in. So, in checking out at the store, a young cashier suggested to the much older lady that she should bring her own grocery bags because plastic bags are not good for the environment. The woman apologized to the young girl and explained, "We didn't have this green thing back in my earlier days." And the young clerk responded, "That's our problem today. Your generation did not care enough to save our environment for future generations." The older lady said that she was right. Our generation didn't have the green thing in its day. The older lady went on to explain, "Back then, we returned milk bottles, soda bottles, and beer bottles to the store. The store sent them back to the plant to be washed and sterilized and refilled so it could use the same bottles over and over. So they were really recycled. But we didn't have the green thing back in our day. Grocery stores bagged our groceries in brown paper bags that we reused for numerous things. Most memorable, beside household garbage bags, was the use of brown paper bags as book covers for our school books. This was to ensure that public property, the books provided for our use by the school, was not defaced by our scribblings. Then we were able to personalize our books on the brown paper bags. But too bad we didn't do the green thing back then. We walked upstairs because we didn't have an escalator in every store and every office building. We walked to the grocery store and didn't climb into a 300 horsepower machine every time we had to go 2 blocks. But she was right. We didn't have the green thing back in our day. Back then, we washed the baby's diapers because we didn't have the throwaway kind. We dried clothes on a line, not in an energy-gobbling machine burning up 220 volts. Wind and solar power really did dry our clothes back in our early days. Kids got hand-me-down clothes from their brothers and sisters, not always brand-new clothing. But that young lady is right. We didn't have the green thing in our day. Back then, we had one TV or radio in the house, not a TV in every room. And the TV had a small screen the size of a handkerchief. Remember them? Not a screen the size of the state of Montana. In the kitchen, we blended and stirred by hand because we didn't have electric machines to do everything for us. When we packaged a fragile item to send in the mail, we used wadded-up old newspaper to cushion it, not styrofoam or plastic bubble wrap. Back then, we didn't fire up an engine and burn gasoline just to cut the lawn. We used a push mower that ran on human power. We exercised by working, so we didn't need to go to a health club to run on treadmills that operate on electricity. But she's right, we didn't have the green thing back then. We drank from a fountain when we were thirsty instead of using a cup or a plastic bottle every time we had a drink of water. We refilled writing pens with ink instead of buying a new pen, and we replaced the razor blade in a razor instead of throwing away the whole razor just because the blade got dull. But we didn't have the green thing back then. Back then, people took the streetcar or a bus, and kids rode their bikes to school or walked instead of turning their moms into a 24-hour taxi service in the family's $45,000 SUV or van, which cost what a whole house did before the green thing. We had one electrical outlet in a room, not an entire bank of sockets to power a dozen appliances. And we didn't need a computerized gadget to receive a signal beamed from satellites 23,000 miles out in space in order to find the nearest burger joint. But isn't it sad? The current generation laments how wasteful we old folks were just because we didn't have the green thing back then. So, what do you think, David? This is my gift to you for the senior hour.
You know, you hit a lot, and this comes back to one of the things, the statements that I hate the most is rewriting history. And just that is history, what you were talking about. And that's the way we lived, you know. And the one that got me was I couldn't tell you how many school books I covered with paper bags. And my mother used the paper bag from the grocery store. She'd tear the corners, and so it'd fold over the trash can right, you know. And no, we weren't. I don't think we were near as wasteful as we are today. And the green thing is, in my opinion, one more left side of the fence ploy to make changes that don't need to be made. And, you know, it's sort of like you listen to them, and their big thing about how Trump has destroyed the world with his releasing of gas and oil and all of this. No, he's given a lot of folks jobs, and made us independent, and we don't have to import like we were 10, 15 years ago. We are independent, and we're very blessed to have a good oil supply. And I think what you just read is very interesting. And by the way, we're going to be doing, I think, a new show that is going to follow this show, as a matter of fact, if plans all go through right. And it's an advocate for, it's a group, it's a lady that has a business that she'll take your hospital bill and go over it with you. And if you have been had by the hospital, she'll point it out and she'll fight the battles for you.
That's exactly what we're going to be talking about with Cynthia Fisher, who will be coming on this show in the next few weeks. It ties in with a brand new book that I would recommend people to buy by Mike McCary, M-A-K-A-R-Y. He is a surgeon at Johns Hopkins and a researcher in public policy, and it's called The Price We Pay. And he talks about the fact that people are being price gouged in the current system, especially by hospitals. It's very unsettling, very troubling what he uncovered, and it fits right in with what this show is all about. And I'm going to try to get him to be a guest on my show, but it sounds like that show would be something that would also be a great landing spot for him.
You know, Hal, one other thing that I want to just carry on from there is that the older we get, and one of these days you'll be my age, I think.
I'm not that far behind.
But, no, you know, I look at stuff, I don't look at it differently, but I have called in my friend and help here because it seems like everything I touch, and it goes from hospital bills up and down the gambit, and the older you get, the easier it is to be confused. And when
we saw that yesterday with Mueller.
Yeah, exactly. And it's like, you know, what should and used to be very simple. Hello, yes, this is so-and-so and so-and-so, and I want to do this. Okay, so it's done. Now, everything has to be electronic, and they'll ask you, you know, what color shirt are you wearing?
Push a button.
Yeah.
Dial, hold on for they put you through an entire menu. They're hoping that many people will just give up because they make it so confusing, and the older you get, the more difficult it is for those people.
Oh yeah, and whether it's electronic forms to fill out or telephones like you just said. And this station, America's Web Radio, we're going to start doing everything we can do to fight it or find somebody that has a business that fights it. And if I have to give away airtime, I'll give away airtime. But it's, you know, and I don't want to say that businesses go out of their way, but particularly hospitals, seems like obviously their patients are people of age, and there ain't nothing easy about dealing with the hospital.
No, not at all. And it seems like they really are, in many cases, not all, but I think we're at the end of the show right now. But it becomes, they're predatory on people who are helpless or who are in desperate straits because of their health care. So I hope that you enjoyed the show, and thank you for allowing me to have the digression in the last segment and share with the seniors who are probably very happy to hear what I've just shared with them, this little ditty. So come back. I'll be back 2 weeks, and hopefully with one of the guests that I've promised. So thank you for being with us.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening to America's Web Radio.
I said David would enjoy this. I'm going to just slip it into the show, especially,
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a